Today, we're going to talk about vitamin D. Now, it's a nutrient that's often misunderstood as just a simple vitamin for bone health. But in reality, it's so much more. It functions as a powerful pro-hormone that directs some of the most fundamental processes in our bodies. We're going to look at its critical role in our immune system, its really deep connection to gut health, and what you need to know about it. So let's dive in. What's so fascinating is that vitamin D doesn't really act like a typical vitamin. It works much more like a pro-hormone. What that means is our body takes it and converts it into a powerful hormone that sends messages and regulates key systems all over the place, from our immune defenses to the actual health of our intestinal lining. And before we go any further, just a quick and important note. This is all for educational purposes. It's not medical advice. You should always consult with a qualified healthcare professional before you make any changes to your diet, your supplements, or your treatment plan. All right, so here's our roadmap. We'll cover what vitamin D actually is, then look at what it does and the signs of deficiency. After that, we'll get into testing and food sources, talk a bit about supplements and safety, and then we'll wrap it all up by connecting it to its crucial role in gut health. So let's start with the basics. What exactly is vitamin D, and why do we call it one of the body's master regulators? Well, first off, vitamin D is a fat-soluble prohormone. That just means it dissolves in fat, and our body has to do some work to convert it into its active form. What makes it so unique is that, unlike most other vitamins, our body can actually make its own when our skin gets exposed to UVB rays from the sun. But here's the thing, whether it comes from sunshine or our food, it starts out in an inactive state. For our body to use it, this vitamin D has to go on a little activation journey. First, it travels to the liver, and the liver converts it into a storage form called 25-hydroxyvitamin D. You'll see it written as 25-OHD. This is the one to remember because it's the main form circulating in our blood, and it's what doctors measure in blood tests. From there, it moves on to the kidneys, and they perform the final crucial step. They convert it into the fully active hormone, calcitriol. This is the form that can actually get to work regulating things all over the body. Okay, so now that we know what it is, let's take a look at what this active hormone actually does. And of course, what happens when we don't have enough of it. You know, the real power of vitamin D comes down to something called the vitamin D receptor, or VDR. It's helpful to think of the VDR as a lock that's found on pretty much every cell in your body, from your brain to your bones to your gut. The active form of vitamin D, that calcitriol we just talked about, is the key. When this key fits into the lock, it sends a direct signal to the cell's DNA, and it can turn thousands of genes on or off. This is how it regulates so many critical processes. So when we're deficient, the effects can really show up all over the place. For our skeleton, a lack of vitamin D means our bones can't mineralize properly. This can lead to things like rickets in kids and something called osteomalacia, or soft bones, in adults. It can also mess with nerve and muscle function, which might show up as weakness or aches. And because it's so important for the immune system, having low levels can make us more likely to pick up infections. Now, some groups are at a much higher risk for deficiency. This includes people with limited sun exposure, individuals with darker skin, and older adults. And this is where we see a huge gut connection. Because vitamin D is fat-soluble, any condition that messes with fat absorption, things like Crohn's, celiac disease, or ulcerative colitis, can directly cause lower vitamin D levels. This all brings us to a really practical question. How do you even know what your levels are? And how can you get more from your diet? The only way to really know your vitamin D status is through a simple blood test. Specifically, you want to ask your doctor for a 25-hydroxyvitamin D test. Again, that's the 25-OHD. This test measures the storage form that's in your blood, and it gives the most accurate picture of your body's levels. So when you get your results back, you'll see a number. Standard guidelines often define sufficient as a level above 20 ng/ml, which is considered enough to prevent bone disease. But in functional medicine, the conversation often shifts toward what's optimal for overall function. You'll see some practitioners aiming for higher levels because they believe that's what's needed for the best immune and metabolic health. This is still an evolving area of research, but knowing the difference between sufficient and optimal is really key for the conversation you have with your healthcare provider. Now, while sunshine is our main source, we can definitely get some vitamin D from food. Fatty fish like salmon and mackerel are fantastic natural sources, so are egg yolks and beef liver. But because there really aren't that many foods that are naturally rich in it, a lot of common foods like milk, plant-based milks, and cereals are actually fortified with vitamin D to help people meet their needs. For a lot of people, especially those in those high-risk groups we mentioned,
Diet and sun exposure alone just might not be enough. And that's where supplementation can become a really important conversation.
When you look at supplements, you're mainly going to find two forms, D2 and D3. D2, which is called ergocalciferol, comes from plant sources like mushrooms. D3, or cholecalciferol, is the exact same form our body makes from sunlight, and it's also found in animal products. It's really important to know the difference because the research is pretty clear that D3 is significantly better at both raising and maintaining vitamin D levels in the blood. Of course, safety is always important. Because vitamin D is fat-soluble, your body stores it, which means it is possible to get too much. Now, toxicity is rare, but it can happen with really high, unmonitored doses. Adverse effects are usually seen when blood levels get consistently above that 50 to 60 nanograms per milliliter range. This is exactly why testing your levels and working with a practitioner is the most responsible way to approach supplementation.
And now we get to the part that ties everything together, especially for anyone focused on their digestive wellness. Let's really explore vitamin D's profound role in the gut.
Okay, first, vitamin D plays a direct structural role. It helps strengthen the gut barrier. It does this by telling your genes to make more of the proteins that form what are called tight junctions. Think of these junctions like the mortar between the bricks of your intestinal wall. When they're strong and tight, they stop unwanted particles from leaking out of the gut and into your bloodstream. Second, it is a master regulator of your gut's immune system, and the gut is a major hub for immunity. Vitamin D helps keep it all in balance. It encourages the growth of special cells called regulatory T cells, which are like the peacekeepers that calm down inflammation. At the same time, it helps dial down the activity of pro-inflammatory cells that are often overactive in conditions like inflammatory bowel disease.
And finally, there's a lot of emerging research showing that your vitamin D status can actually influence the makeup of your gut microbiome. Studies have found that when people who are deficient start supplementing with vitamin D, they can see an increase in the diversity and amount of beneficial bacteria. So it really seems like vitamin D helps create a healthier, more balanced gut ecosystem.
So to quickly summarize the most important points, remember, vitamin D is way more than a vitamin. It's a pro-hormone that acts like a master key for your genes. Your gut health is a two-way street. It affects how well you absorb vitamin D, and in turn, vitamin D is critical for your gut's immune function and barrier. And, most importantly, testing is the only way to know where you really stand.
And we'll leave you with a question to think about. How might having this deeper understanding of vitamin D change the way you approach conversations about your overall and gut health with your provider?